Hi guys, so for week 9 I focused on the questions surrounding what is the issue surrounding drug companies and doctors' prescriptions, and for that I mainly focused on the article High-Tech Stealth Being Used to Sway Doctor Prescriptions, written by Cheryl Gay Stolberg and Jeff Girth. Basically what this article is saying is that since the 1990s the government has been able to see all these different files and all the different medicines that patients are taking. They do this in the purpose of tracking where the prescription drugs are going, what are they being used for, how many are being sold, and then they gather up this whole list and then they sell it to different associations such as the American Medical Association and other large companies for as little as $10,600 per month for someone to have this list. Which is a crazy amount, and that number can change depending on how many people this is going to be distributed to. So that's a large sum of money, and basically these associations get a hold of these lists, then they pinpoint which doctors are using which medicines, which hospitals, which facilities are prescribing this medicine, and what they try to say is oh, this doctor is prescribing a lot of this cheaper medicine when they could be prescribing the same thing basically, but more expensive and a different name. So they want the doctor to try to sell the more expensive one, and so they'll sit down there and they'll try to bribe them. Or they'll see doctors that are prescribing this medicine and they'll be like, that's expensive medicine, I want you to prescribe that more. So everyone that's taking something similar to that for the same reasons, tell them that this is better. And that's basically what they try to do in order to make more money, which is sad to think of it that way, but it's true. And so the good news is that out of 100% doctors, only about 40% actually go through with this and have been found to be associated with these kind of deals, which is still a large percentage, but at least the majority still sees that an individual's health and the patient, taking care of the patient, is more important than that extra profit. Because these associations like the American Medical Association is taking the doctors out to dinner, buying them expensive dinners and lunches, and they're also trying to discuss with them. They're like, hey, if you do this, we'll give you these vacations, we'll give you this bonus, and blah blah blah. And they're offering them so many nice gifts that I can see why doctors would kind of be like, maybe this would be a good idea, I'd be making more money. But luckily, not most doctors as of right now don't think that. They think that the patient's health is more important than the total economic growth. And I agree with that. I know that if I found out that my doctor was just doing that, I would be disappointed, because I as a person that takes medicine every day for different health reasons and need to take it every day, and I have several family members the same way. We live in a world where almost 60% of Americans take prescription medicine. And so to take advantage of that large amount of people and to try to make even more money and a large profit for the government already is kind of ridiculous, because I know that I don't want to go to a doctor's office and they view me as just some way to make more money. I want to go to a doctor's office and be viewed as a individual and someone that they want to hopefully get them to be the healthiest they can be. I don't want to just be seen as a profit. And so that's the main problem concerning that. My big thing is that as long as doctors don't agree and don't decide to go in on these deals and go along with it, then they can't make money. But the more doctors that do agree and the more facilities that do say, okay, we'll do that for you for these bonuses and stuff, that's when the number's going to go up. So as long as people in the medical field can say, hey, that's not right, I'm not going to do that. As long as they can continue doing that, they cannot make any more money. And so that's my main point that I want to try to make, and hopefully in the future they will continue to have that mindset that the health is more important than a couple extra bucks. So that was my response for week 9.